Hello, my name is Ryan Mack, and I'm president of Optimum Capital Management. And we are here in a defining moment in our country because with this exciting debate about healthcare reform, the decisions that we make over these next few months will decide the fate for future generations to come. Not only will our generation benefit from this, but our children and our children's children will be looking back on those decisions that we make about healthcare reform over these next few months. And it's ever so crucial that we get it right. So we ask you, and I implore you to make sure that we are researching and learning about this debate as frequently as possible. Read for yourself and make sure you're getting all of the information that you can, because quite frankly, there's been a lot of misrepresentations, some misinformation, and just blatant lies that have been going on about this healthcare reform and this what has been proposed. So what I wanted to do, and my small 2 cents that I wanted to contribute today, is just to try to weed through some of those things that are misconceptions and that misinformation and those blatant lies that have been put out there, so we know exactly what is in the bill currently and what we would like to get in, or what I would like to get into the bill. Because at the end of the day, Barack Obama, we worked very hard to put him into office, and the American people want health care reform. But all the videos and all of the songs and all the singing that we did to put Barack Obama in office, we don't hear that anymore. And it seems like he's a man on an island by himself. And it's time for us to come together to make sure that we can get the truth out there about health care reform. So let me just talk about some of the things that I've been seeing and hearing, and I'm sure you've been hearing about them as well in the media and on the blogs, about all the misinformation, all the lies that have been being spread. And I'll try to stay as calm as possible. It's been too much yelling. It's been too much screaming been going on. I'm very passionate about this topic, as I'm sure you are as well. But I'm going to try to stay as calm as possible, because it's time that we don't yell or scream at each other, but just talk to each other in a way that we can be agreeable even as we disagree. And after this is over, I'm going to give out my email and information, and I'm welcome to any debate to have a informational and have a well thought out discussion with any one of you out there. And I thank you for this time to listen to me today. The first myth that we would like to talk about is the rationing of costs. There's been this huge myth that when the government takes over healthcare, that there's going to be this rationing of healthcare costs in terms of how much they actually provide. Well, first of all, the government is not looking to take over any healthcare plan. You know, the public option is about the closest that you're going to get to that, but that is, just as Barack Obama said, just one sliver of a much broader plan. Okay? Now, I personally am in favor of the single payer option, but that was never on the table from the beginning. That is extremely close to a government-run healthcare plan. I'm for that. I think that the United States is the largest and the only industrialized country in the world that still practices sacrificing human lives in order to make private profit. And I don't think that we should make a profit off of other individuals' health care, off of other people's lives and sacrificing people's lives. So I definitely would like to address that with the single payer, but that's not on the table. The compromise is the public option. That is a government portion of the healthcare plan in which the government will begin to pay into this, and you'll be paying into this just like premium, but it's a not-for-profit option. It's not out to make a profit, essentially using your health as a bottom line expense, which is what the private industries are doing. So the government is not out to take over the healthcare plan. As far as rationing costs, there's already rationing of costs out there. How do you think that Caremark RX can pay Edwin Crawford $70 million a year? Okay, he's in the pharmaceutical industry. How do you think that Aetna can pay Ronald Williams $31 million a year? How do you think that United Health Group can pay almost $300 million to Willie McGuire over the past 5 years? They're rationing your costs in order to help subsidize these exorbitant costs and exorbitant salaries of these CEOs. So there's already rationing of costs going on out there that we should already know about. Okay, so I did just some basic calculations here. Willie McGuire, again, over the past 5 years, the CEO of United Healthcare Group made $298 million. You divide that by the average healthcare cost of $12,000 a year for the average family, and that was 298 divided by 12,000. That's almost 25,000 people that one man's salary could have provided health care coverage for an entire year. If you compare that against the 18,000 people who die every single year because they do not have health care coverage, again, 25,000 people could be provided by one man's salary compared to 18,000 people who die every single year. These are numbers that are quite exorbitant and that, at the end of the day, are extreme examples of how they are rationing costs. Okay, let's look at, 13,500 people could be covered just by, at the end of the day, Edwin Crawford's salary for the past 5 years. That's amazing. That's an amazing figure because 13,500 is extremely close to the figure of 14,000 people who are dropped from coverage every single day. 14,000 people across this country are dropped from coverage every single day that we could provide coverage for an entire year for with just one man's salary. So you're talking about rationing costs. There's a lot of this rage and fire and animosity towards these CEOs towards the government over a proposed plan of what they could do, but there is no rage. There is no fire against the private industry about what they are currently doing. So we have to understand that. The medical board's job of private companies, whether you like it or not, their job is to ration costs. They view your health care coverage as an expense. You are a part of the bottom line, and if they can cut you and drop you in order to make their bottom line go higher, their top dollars go higher, and earn additional dollars to make their profits increase, they're going to do just that. So we have to understand that the medical boards are already rationing costs. We have to understand that when you're looking at 12 million individuals who are discriminated against because of various pre-existing conditions, that's every single year. People who do have coverage who cannot claim, who cannot process their claims because the medical companies are rationing costs. All those, again, those 14,000 individuals who are dropped from coverage, rationing costs are currently happening right now. There is no outrage for that, but there's outrage for a proposed plan that the government might want to ration costs. And again, we just have to make sure that we pick the best fights that are on our side. I don't know how we got to this point where we're protecting the private industry and so have so much animosity towards any proposed plan that the government wants to have. Let's talk about the myth of the death panels. Okay? There's this huge thing that I don't want the government to stand between me and my doctor. I don't want the government to make sure at the end of the day that, stopping me from getting my health care and my provision. Well, guess who's standing between you and your doctor right now? That's called the insurance company, the medical board. I have friends and colleagues who are healthcare attorneys who are, at the end of the day, representing insurance companies. They hire them specifically not to represent your interests, but to represent the insurance company's interests. And then when they're going to court and they're trying to litigate on the insurance company's behalf, they're really trying to cut their expenses. Cutting expenses meaning cutting your claims. That's their job. That's whose interest they're representing when they hire these attorneys. Okay? The internal appeals processes. These things are designed by insurance companies to cut costs and making sure that they can look at things and decide which people are whether or not are worthy of getting their claims paid out. That sounds like a death panel to me, but there is no rage against the death panels with the medical boards and the insurance companies litigators and these individuals out here who are in the internal appeals processes, and those individuals that happen to run into a limited amount of caps on their health care coverage. There is no, and at the end of the day, they'll demand private arbitration because they don't want to pay for the cost of actually taking you to court. So this is a death panel. This is essentially, so there is no outrage against that, but then there's an outrage against this proposed death panel against the health care of a government proposed health care plan with the public option.